we are going to be talking about a lot about Medicaid expansion, but we're also going to be talking about a couple other coverage issues in Texas as well. As I mentioned, I'm Cindy. I'm the Health Policy Associate with Children's Defense Texas, and I'm going to give Laura a chance to introduce herself as well right now.
Hi, everybody. I'm the Deputy Director for the Children's Defense Fund of Texas, and a longtime advocate, along with Texas Impact, B. Moorhead and her team on coverage expansion and coverage for children and families. And thrilled to be here with you and excited to, help support the wonderful presentation that Cindy G has prepared for y'all today.
Yay. So today, our goals are manyfold. We'll obviously be sharing with you a lot of information about Medicaid expansion and empowering with the tools that you need to be able to take action on healthcare coverage in your own communities. I did see a few people mention in the chat that Medicaid expansion has been a political hot button, and that is very true. But at the end of the day, people having access to coverage, to healthcare coverage and health insurance shouldn't be a partisan issue. And we'll do the best that we can to present information so that you'll be able to engage in this issue on your own terms. And our goal is not to just give you this information, but also give you the tools to design an action or activity that you'll be able to bring back to your own communities. And that's why we'll be doing a breakout group activity, as Bea mentioned earlier. Before we get started, I do want to share with you some of the coalitions and campaigns that we are part of. So Cover Texas Now is a statewide coalition focused on expanding coverage. The Children's Health Coverage Coalition shares a lot of the same policy priorities, but often through the lens of children's health specifically. And finally, the Sick of It Texas campaign, which is the newest of these, is focused on grassroots actions and getting constituents to take action and speak up and contact their leaders on healthcare. I mention this because as you get more involved in healthcare, you'll probably hear about these organizations, and because a lot of the materials that we'll be sharing with you today are from our partners in these coalitions. So we wanted to give a shout out to them as well. As we get started, we'd love for everyone to take a few minutes to reflect and write about what health insurance means to you. So we have 4 questions on this slide, and we're gonna give everyone right now 10 minutes, take out a notebook or a piece of paper, and just take a few moments to think about these questions. The issues that we'll be talking about are a lot less abstract if you can think to your own life and the people in your lives and how they are personally experiencing access to health insurance. Okay, coming back now, I really appreciate everyone's responses in the chat. And I hope that everyone has learned something just from seeing other people's responses to these questions. Some of the common things that I've been reading and keeping an eye on in the chat is how, in this state, in this country, our healthcare coverage is often tied to our jobs. And if we're unemployed, if something happens, then we might lose our insurance along with that employment. Another thing that I've been seeing a lot of in the chat is concerns about the cost of medication and the cost of treatment. And how having health insurance certainly makes a huge difference in making those necessary things more affordable. I've seen a couple references to charity care and hospitals, and certainly there are people in this state who, think of taking action on healthcare as making sure that people who are uninsured can access services and go to a charity hospital. But as some of the people mentioned in the chat, that's not always enough, and that's not always adequate to meet people's needs. The reason why our goals are focused on expanding coverage and making sure that everyone has access to insurance is that that does help increase the chances that people will actually seek out preventative care and proactively take care of themselves in the ways they need. And as others have mentioned, expanding coverage and having more people who are insured also brings down the healthcare costs overall. So I'll jump into our presentation now and share more information about Medicaid expansion specifically. All right. So Texas has the highest uninsured rate nationwide. That has been true for a long time now. As of 2019, 18.4% of Texans were uninsured. And with COVID, as many people lost their jobs and with it their health insurance, a report that came out this summer estimated that nearly 1 in 3 adults in Texas under the age of 65 are uninsured. As I'm going through this, by the way, if you feel like I'm not speaking loud enough, or if you need me to slow down, or if I reference a word that, or a policy word that you don't know, like raise a hand in the chat, call me out, and I'll make sure to adjust and make sure that question gets answered. So what have our leaders done so far this year for healthcare? One of the things that they did and passed actually last year is that they renewed a partial extension of the 1115 waiver. When I say that, probably many of you are thinking, what in the world does that mean? Well, for the past few years, instead of expanding Medicaid, Texas has used this waiver to get needed federal funding to help keep hospital doors open. By extending this waiver this year, Texas is continuing that funding for hospitals, but it is losing some of the funding for some of the services that our state and our uninsured patients depended on in the past. So our state had something called district funding, and that funded things like care for people with serious mental health needs, including illnesses like schizophrenia and bipolar disorder. What we know is that 40% of district funds went to services for uninsured patients, and that is now just gone. And the waiver does help bring in this needed funding, and we are glad for that. But without a coverage solution, uninsured Texans are left worse off than they were before. The waiver doesn't do anything to address healthcare coverage now or before, and all that means is that our leaders' work is not over. And that's where we come in. We have the power to let them know that we want them to address coverage and not just funding for our hospitals and providers. So I'll be talking quite a bit in depth about Medicaid expansion because it is pretty complex and also pretty contentious, as many of you already know. So laying out what it actually looks like. Right now in Texas, qualifying for Medicaid is pretty difficult. If you are an adult in Texas, you need to have kids in order to qualify for Medicaid yourself. And the income limit to qualify for Medicaid expansion is incredibly low at just 17%. By expanding Medicaid, it would increase that income eligibility to 138% of the federal poverty level, which is only $17,000 for an individual. So as you can see, it's not, it's still a pretty meager program. You still have to be fairly low income in order to qualify for the program, even under Medicaid expansion. But the key here is that there are a lot of low-wage workers in Texas, people who are childcare providers, people who work in grocery stores, people who are in other low-wage but essential positions who don't have access to Medicaid and might be making too little to qualify for any kind of insurance at all. So, to qualify for something like insurance through the Affordable Care Act marketplace, you need to be making at least 100% of the federal poverty level. And that means that our state currently has a coverage gap where people making a certain amount of money and are low income have no insurance options at all and are uninsured. This next slide shows the profile of those who could get Medicaid under expansion in Texas. The majority of them are people and families with at least one worker. Nearly 3 in 4 are adults living below poverty. Nearly 6 in 10 are Hispanic. Almost 4 in 10 are middle-aged, and a good proportion of those who would qualify are near elderly, which is a population we know is more likely to have serious health needs. And lastly, over half are women. And Medicaid, the benefits of Medicaid expansion aren't just in providing health coverage to low-income Texans. It is also, as some folks mentioned in the chat earlier, it increases utilization of care. It improves affordability of care across the board. It improves access to care. It makes it easier for our providers to financially, because they would have fewer uncompensated care costs. And it reduces medical debt. Carol asked in the chat what qualifies as poverty. I don't have the exact number for you, but the 100% of federal poverty level, I believe, is somewhere, actually, I don't know the answer to that. But Laura, if you have that answer, if you could put that in.
Yeah, I can put a link to the federal poverty level chart for 2021. It gets updated every year. And, you know, the definition of poverty, I think, technically originated as below 100% of the federal poverty level. Yes. Some think that because we haven't truly updated those measures for the cost of food and other things, that it could even range, you know, in reality, up to 200% of the federal poverty level of what it really takes for people to have a living wage. But I'll put that chart in there right now. Mm-hmm. And thanks to those who are giving some examples in the chat.
Yes, thank you. The other key thing about Medicaid expansion is that the financing brings in a significant amount of federal funding to Texas. So currently, for every dollar that our Medicaid program spends, Texas pays 38 cents of that, and the federal government pays 62 cents of that. Expanding Medicaid means that we would increase that match to 90% and just 10% for newly eligible groups. And that would bring in an estimated $10 billion a year in federal funding. And it would also, so when we expand Medicaid, that new match rate would also help cover some of our existing Medicaid populations. And I'll talk more about that in a second. But first, I want to show you this map, which shows where our Medicaid expansion eligible populations are in Texas. So as you can see, there are a few major cities where there are large numbers of people in the coverage gap, as well as in a lot of counties in the Valley, as well as in the Panhandle. And one thing I should note here is that often in Texas, we'll hear this narrative that the reason our uninsured population is so high is because we have a lot of immigrants and a lot of people who are not eligible for public programs. But the reality is that Texas's demographics are not entirely unique. And we do know that in other states with high immigrant populations, they have fewer uninsured people because they are using all of the policy tools at their disposal to reduce their uninsured rate and make sure that their eligible folks can and do enroll in healthcare coverage. So I want to go back to the state budget impact. As I mentioned, there is a higher match for our Medicaid program when we expand it. And this essentially breaks down what that cost looks like. It's really dense, but to go over this quickly, it would cost about $6.3 billion to cover an estimated 1 million Texans who would enroll in Medicaid if we expanded it. 10% of that for Texas means 630 million plus a couple 20 more million for administrative costs. But our state would actually save a lot more money and create new revenue under Medicaid expansion that would more than offset these costs. So from revenue from health plans and other services and fees, we would generate about 110 million. But as I mentioned, Medicaid expansion would cover some populations that Texas is already paying a higher share for. That includes pregnant women. That includes people who are using community mental health services. That includes inpatient care for our prisoners. And it also includes Texans who are in substance abuse treatment services, in our HIV medication assistance program, and the kidney healthcare program. And one other thing that I want to cover here is that COVID-19 is obviously on all of our minds. And this pie chart essentially shows what happened to the Texans who lost their health insurance during the pandemic. As you can see, about a third of them became Medicaid eligible. About 10% are not eligible for any kind of public programs and might have access to insurance through a family member or aren't eligible at all. About another third became eligible for insurance through the ACA marketplace. But more troublingly, about 24% of them fell into the coverage gap, meaning they had no options for healthcare and were likely to be uninsured. To Lisa's question, yes, so we shared these slides with Bea and Scott, and we were happy to share them with you all. Okay. One other thing that is a huge issue in Texas is that we also have the highest child uninsured rate, and many kids in Texas who are eligible for Medicaid are actually not enrolled. We do see a huge increase from January 2014 to December 2014 in enrollment, and that is due to the Affordable Care Act. And we see that the child enrollment level kind of holds steady for a few years, but then begins dropping off in December 2017. And that's the result of a few different things. One of them is attacks on the ACA from the Trump administration. But another component of that is the public charge rule, which in short, essentially the Trump administration created new rules stating that immigrant families need to meet a certain or rather that immigrant families who use certain public programs would then not be able to pursue their green card or citizenship. There's also a lot of confusion and intimidation and misinformation around that. And so a lot of kids who are eligible but in mixed status families have not enrolled because their family members are worried that it will affect their pathway to citizenship down the line. And lastly, yes, there is a significant uptick in March 2020. That's the result of our public health emergency and the fact that no one is being kicked off of Medicaid right now. I want to cover this issue because it's another key coverage issue that CDF Texas does a lot of advocacy on. Those kids who are in Medicaid also face barriers to maintaining enrollment. So most of us who have private insurance, or even those of us who receive Medicaid or have ACA insurance, renew our health insurance once, and then we have that for the rest of the year. But for kids in Medicaid, in addition to renewing their Medicaid every year, they face the possibility of additional income checks at months 5, 6, 7, and 8 of their enrollment. And essentially what our state does is it runs all these kids through their public databases. And if the database flags that this child's family's income may have gone up, it will send out an automated letter to that family requesting them to prove that their kids are still eligible for Medicaid. This ends up being a huge issue for a lot of families because these state databases often have bad data. Sometimes if a family member starts a new part-time job, their old part-time job might still be in the system, and that will trigger a letter. If the families don't respond to the letter and they only have 10 days to respond, their kids are automatically disenrolled. And the key thing to note here is that when families do perform an annual review and their income goes up a little bit, if they're eligible for CHIP or for another program, the state will automatically enroll them. But if they get kicked off during a mid-enrollment income check, they just lose their insurance. And as you can imagine, this is a huge issue if children are losing access to the medication and regular routine checkups that they need to stay healthy. It could mean eliminating these periodic income checks could mean the difference between a child being able to access their inhaler when they have an asthma attack at school or going to the emergency room because they no longer can have access to their asthma medication. So I wanted to briefly share our healthcare policy priorities for the session. Medicaid expansion is obviously a huge one. We're also fighting for 12 months of continuous eligibility for kids on Medicaid so that their families are only completing income review information once a year instead of several times throughout the year. We also are supporting extending maternity Medicaid to 12 months after birth rather than just 2 months. This is something that a few folks mentioned earlier in the chat. One of the reasons this is so crucial is because Texas does have a pretty high maternal mortality rate. And our state's own maternal mortality and morbidity task force found that most of our maternal deaths are preventable, and the majority of them happen after the 2-month mark, which is right when we kick moms off of Medicaid. One thing to note is that if we expanded Medicaid, 12 months of maternal Medicaid coverage would be part of that, but we do want to fight for that separately as well. We want to prevent budget cuts to healthcare services, especially during a year where we have a revenue shortfall. And finally, we want to revitalize and reinvest in outreach and enrollment support. And that's crucial because, as we mentioned, a lot of eligible kids in our state are not currently enrolled, and we want to be able to reach these families and make sure they have the right information and knowledge to enroll their kids, and also to know, that enrolling them in Medicaid will not necessarily affect their immigration status and path to citizenship down the line. There are a few more policy priorities. I won't go into these in detail, but these are the priorities that we share with our coalition members. They include promoting telehealth and telemedicine, strengthening our surprise medical billing protections, improving coverage for people who are buying health insurance on their own, removing barriers to enrollment for our state women's health programs, and having statewide guidance and accountability on COVID testing, workplace exposure, and making sure that our home health workers and personal attendants have adequate personal protective equipment. But what we are here to talk about is what we can do to make these policies a reality. One thing that we noticed is that CDF and our partners have been advocating for healthcare coverage and coverage expansion for many years now. And the reason that we ended up starting the Sick of It Texas campaign is because we realized that the reason we weren't succeeding was not because these policies weren't good, but that we had an issue of politics and not policy. And the way that we wanted to overcome that was by building people power. And I want to take a moment now to ask what people power means to our participants on the call. So if you could take a moment and in the chat, type what people power means to you. What is people power, and what does that mean? Many of us advocating at the same time to all of our reps. Critical mass. Humans showing up, yes. People having a voice. Unity and public display of need. Voters in a block pushing a specific agenda. This is great. Okay. Yeah, this is great. You're all on the mark here. Essentially, as many of you mentioned, I love showing this graphic because I think it's a really great illustration of people power. Our leaders do have a lot of power, but at the end of the day, they are accountable to their constituents. And if we are organized and we demonstrate our people power, that we can have power over them. People power is the difference between showing up to your legislator's office and telling them that you support a specific policy, and showing up with a petition with hundreds of signatures on it, demonstrating that people in your community are thinking about this issue and care about this issue, and are also watching to see what your elected leader will do on that issue. Now the question is, how do we demonstrate people power for an issue like Medicaid expansion? There are obviously a lot of different tactics that can be done, but we wanted to share a few that our campaign has done to jumpstart the conversation around our later breakout group activity. Ultimately, we want you all to be thinking about how you can activate those in your own community to take action on Medicaid expansion. And so we'll go over a few examples of some of the tactics that can be used and that have been used. So the first things first, who are our targets? Who has the power to make Medicaid expansion happen? Obviously, our governor, Greg Abbott, could expand Medicaid through an executive order if he wished. He will also be responsible for ultimately signing off on passing a Medicaid expansion bill. Our Lieutenant Governor, Dan Patrick, also has an outsized role in expanding Medicaid. And one of our other targets is Senator Lois Kolkhorst, who is the chair of the Senate Health and Human Services Committee. Historically, the Senate has been the chamber in our legislature that we've needed to work on more to get more support for Medicaid expansion. And she is the person who determines what bills are heard and what bills are not. Finally, we wanted to list your state senator because, again, we really want to work on building support in the Senate for Medicaid expansion this session and also moving forward. So one of the questions that our campaign thinks about is how we demonstrate people power to these leaders. So one of the things that we have done is host a postcard campaign where we printed thousands of postcards with a variety of different designs. Some of them featured kids' artwork, others featured stories from people that we know who have been in the coverage gap and have suffered and had to be uninsured because of our lack of Medicaid expansion. So this postcard that you see is actually from our volunteer with Young Invincibles, who is a home health worker and has cared for people in nursing homes, but has a job where she doesn't have benefits through her employer, and also makes too little to qualify for other insurance, but too much to qualify for Medicaid. And what we did is we had people all across the state claim their postcards, write handwritten, personalized messages about what Medicaid expansion means to them, and then send those in and mail them to all 180 plus members of our legislature at the start of session to let them know that healthcare expansion is a priority for us this session, and we expect our leaders to take action. Another thing that we did earlier this year, which is more of a creative tactic because we were not able to do in-person actions due to COVID, is that we created this huge Expand Medicaid candlelight vigil and this video animation that we then projected onto major buildings throughout Texas. So in the center, you'll see that this was projected onto a building across from the Capitol, and actually across from the governor's mansion. On the right, there was our projection on Houston City Hall. And then we also had projections in Dallas and El Paso and Fort Worth, in Lubbock. And I think I got all of them, but there were 7 cities that participated in this, and we wanted to show the broad support for Medicaid expansion, and also to create this powerful image that our message is embedded in the very cities that Texans are living in and the communities that we're a part of. So here are some other tactics that the Sick of It Texas campaign is hosting currently, and that you can get involved in right now. We have a letter writing campaign where we've provided a template where you can write directly to your representatives in both the Texas House and the Texas Senate. You can call your state senator, or we also have a click to tweet action targeting Governor Abbott, our Lieutenant Governor, and Senator Kolkhorst. We're also encouraging people to share your health coverage story, especially if you've been uninsured or are uninsured or in the coverage gap. We need to demonstrate to our leaders what it means for uninsured Texans to have access to coverage and how critical that is. And part of how we make that case is by sharing stories with them and sharing the real experiences of Texans with them. If you don't have a health coverage story yourself, we have a tool where you can survey members of your community. So if you already work at a food bank or volunteer at another service where you probably interact with people who are uninsured, and there's an easy way to survey those folks, we have an easy tool that you can use right there. And actually, before we get into our power building activity, I know that there have been some questions that have been entered. So I want to take a moment to answer them now. If it's okay, Laura, I can read the question to you and then you can answer?
Sure, yes, I was just also answering the questions, I guess, in the Q&A section. And one question is asking if we can send all the links in the chat via email. So we'll just, put something like kind of an addition, maybe an extra slide on this presentation to make sure you have the latest data. Although it might already be there, we'll see. But yes, Cindy, let's try.
Okay. So yeah, we'll definitely make sure we share these slides, and I'll defer to Scott and Bea on how they're sharing the materials from this conference, but we definitely want you all to have these slides and have all of this information as well as the links in this presentation. Darlene has asked, based on past research and data, what is the major objection lawmakers in Texas have to Medicaid expansion?
Yeah, I put it, I think I wrote it in. I'm not sure if I'm doing it quite right, but most object to the growing the Medicaid program. Medicaid has been a program that a lot of conservative legislators, not all, but many have not always been a fan of, have always kind of looked for ways to make it smaller. And, you know, even though that historically the largest population that our Medicaid program serves is our children. And so it's the primary source of coverage for about 1 in 3 children in Texas. But with population growth, and as we got better at reaching children who were eligible and getting them enrolled, the caseloads grew. It's one of the biggest parts of our budget, but you have to be careful when legislators are talking about that, because often they point to the all funds budget, which means the money that Texas put in, and then the matching money that you know, how we were able to bring our tax dollars back from the feds. And because Medicaid has such a great value of bringing federal dollars back, when you look at the all funds budget, Medicaid looks really big. And that's, they've always kind of utilized that one data point, not just what the state is putting in, to feel that it was just too large of government and it needed to be smaller. And so for Medicaid expansion, when you are going to grow a program that they think is way too large already, there's that ideologic opposition to it. It was also passed by Obama and the whole anti-Obamacare organizing that happened. This is a legacy of that. And so we really, there will be reasons, members who still, you know, who publicly oppose Medicaid expansion will give, but at the end of the day, it really is political, the financial data, the health impact data, even funding to local communities is all very positive. And that's part of the reason we created the Sick of It Texas campaign, with the recognition that we're not going to change members' minds only by bringing them a new piece of data or trying to convince them it's the, you know, the right thing to do. We needed to tell them that we are telling a lot of other people in their community about how this doesn't make any sense. We think that that's, you know, when it becomes a political question for a legislator of whether what his or her constituents are going to think come election time again, you know, how their reputation is in their local community. We think that might be the hook for them to start giving it more serious attention. That said, this year is the first time that during the election cycle, members on both sides of the aisle have said that we needed to do Medicaid expansion or something similar. So the tides are shifting, and it's kind of upon us to maximize the growing opportunity that we have to get coverage expansion in Texas. Sorry, that was a little long. Hopefully it answered a few people's questions.
Great. Mark asked, do you think that budgetary pressure this session will help legislators see the light on this issue, given that it is a budget positive?
It's tricky. I think the original estimates from the comptroller that showed that we might be entering a really bad, you know, budget cycle, that our revenue really had plummeted, you know, was expected to really plummet due to COVID, would have been a bit large motivator to do Medicaid expansion, because it's an economic stimulus. The studies do show that it is at the very least budget neutral, and most likely budget positive. It's definitely budget positive for local county budgets. With updated revenues from the estimates from the comptroller, it turns out we're not in really a bad budget situation, which is wonderful. But I think it does weaken a bit the lever that we expected to have with the budget. The other piece that has created a bit of a challenge is the extension, the partial extension of the 1115 waiver that Cindy mentioned earlier. Without that funding, our hospitals would have really started to close their doors. We would have been really off a cliff for our healthcare system. And the opportunity there was to negotiate with the feds on keeping that hospital fund and doing Medicaid expansion. And, to be honest, Texas missed the opportunity. The governor and those that led that, some would say, including the Children's Defense Fund, that it was a missed opportunity. At this point, we are, of course, glad that Texas is receiving critical funds that we all believe, that we all think are very important. But we are registering our opposition at the federal level that the waiver was fast-tracked when those kinds of funds are actually not supposed to be fast-tracked, and it skipped the public comment period. So the public was not allowed to do anything. It was passed in the last 5 days of the Trump administration, and it was approved for 10 years. So it is very possible that the Biden administration may revisit that. And we could have an opportunity to advocate at the federal level if they, for example, open the public comment period again. So I think that's something unique to this year and the new administration, that we want to have our eye on the Texas legislature, but also be ready to act at the federal level if the 1115 waiver discussions open up again, or if there are other opportunities to move there. But all of it, again, comes down to making your call, getting 5 other people to do so, thinking about how to get more and more people engaged in your community and communicating that to people. Because again, you need to communicate to people with the political language, not just the policy language for this issue.
Great. Andrea asked, do we have cost figures showing the impact of COVID on the target group if they'd been in the coverage gap population prior to March 1st, 2020? Indigent care costs frequently fall to the county. What is being done to recruit county judges and commissioner to encourage Medicaid expansion, or provide statistics on how their financial situation might change with Medicaid expansion?
That's a lot of good questions. Let me try to see if I can address, if I remember them all. But a link I put in previously, and I'll put it in again in a bit. You can also Google the Episcopal Health Foundation, and in the drop-down menu, Medicaid expansion, they have their research home. That one has 2 important new studies. One is how Medicaid expansion would impact the Texas budget, and that's the piece that shows specifically shows you the math of why those researchers, which are well-renowned, believe that Medicaid expansion is a budget positive. It shows you programs, the Band-Aid patchwork programs that we pay for with generally all state funds, that could, we could be getting a 90% match for. So that's one study. The other is a study from A&M that provides county level data, both of those that would be eligible for expansion, but also how the money flows into local communities. So that's a really good one to just have on hand. And per your note, county judges have actually been very supportive over the last 10 years as we've tried to get coverage expansion for that very reason. When we leave people uninsured, of course, they don't stop getting sick. They continue to get sick, and they show up later in the disease process when things are more expensive to treat, and they show up in the most expensive settings. And that cost is absorbed somewhere, and it's absorbed in local communities. So I think, there was strong advocacy the first few years after the ACA passed. During the Trump administration, because of their position and kind of having to rapidly respond to so many threats coming from the feds, it really didn't have the space to organize the business community and the county judges the way we had. But now that is changing once again. And our work is to make sure every chamber of commerce, if they don't support Medicaid expansion, then they better be saying that Texas needs to expand coverage to uninsured Texans. And if they can't, for any reason, say that, they better be saying that the high uninsured rates in Texas are not okay, and that the legislature needs to do something about it. County judges, we need to round them up again, and they need to start speaking up. So that's when you're thinking about your community plan, those are the right organization, the right entities to be thinking about. Visiting with your county judge, visiting with your business chamber, asking the questions, bringing that to your legislators. And the Senate has really been the holdup. So if I just offer that as some information of also if you have limited resources where you might want to target your advocacy efforts. Generally, for many sessions, we probably had the votes in the House to pass some form of coverage expansion, and we really need to have the Senate be a place that this legislation can be discussed and can pass. And of course, the governor can always single-handedly do this. So that's why since COVID began, we really targeted our actions to the governor. But now that session is starting, we need to hold our, our legislature accountable for this as well.